Namaste, Dr. Abhishtita here. So today I'm going to be talking about a condition which affects a lot of people and is very, very common, and this is known as sinusitis. So firstly, let's understand what a sinus is. So sinus is an air-filled cavity present in your head. There are four paired air-filled cavities. There are two above your eyes, which are known as frontal sinuses. There are two below your eyes, which are known as maxillary sinuses, which are the largest and most commonly affected in a case of sinusitis. You also have a sinus between your eyes, which is known as ethmoidal sinus, and two paired sinuses behind your eyes, which are known as sphenoidal sinuses. So they're four paired air cavities. They have a thin lining around them. They usually produce a little bit of thin mucus, which is drained out through various channels which are interconnected, and it finally connects into your nasal passage. And this thin mucus helps keep the nasal environment moist and free of bacteria. Now, in sinusitis, what happens is there's an inflammation of the lining of the sinus, or you can even call it swelling. And ideally, sinuses should be filled with air, but when they're filled with fluid or phlegm, that is when you would have an ideal environment for bacterial growth, and you might have a bacterial sinusitis. So sinusitis can be of various types. So it can be acute, chronic in onset. So acute is basically a very sudden onset of sinusitis symptoms. Chronic is when you have symptoms for up to 12 weeks. Subacute is an acute onset, which is kind of just lasting for a much longer time than what would be expected, beyond 10 days or 2 weeks also, and will have a waxing waning pattern. Now, as far as sinusitis symptoms are concerned, the most common are a feeling of a cold, a runny nose, a stuffy nose, a blocked nose, facial pain or pressure around the sinus which is actually affected. So you might have pain here. You might have a very typical headache here, especially if your frontal sinuses are affected, and this headache, it tends to be chronic, very recurrent, worsens when you tend to bend forward. So that's a very characteristic symptom of frontal sinusitis. Apart from this, because of the excessive and very thick nasal discharge that you'll be having, which is actually originating from the sinus itself, you might have something known as a postnasal drip, which is a drip of the mucus and to the back of your throat. And this can sometimes trigger a cough. So these symptoms can be very similar to allergy symptoms. You might also have runny eyes or itchy eyes sometimes, and usually it starts off with this before it worsens into sinusitis. You can also have fever, especially if you have an acute bacterial or viral or fungal sinusitis. You can definitely also spike up or mount a fever. Sinusitis treatment. So first thing is, how do you diagnose sinusitis? So obviously for this, you would need a doctor's help. So a doctor would take your history. Based on your history and a certain amount of physical examination, they would come to a diagnosis of sinusitis. Sinusitis treatment is based on what kind of sinusitis it is. Is it acute? Is it chronic? So if it's an acute bacterial sinusitis, you would require antibiotics. Of course, you cannot take these on your own, and these are not over-the-counter drugs. They have to be prescribed by a doctor or an ENT surgeon, a physician. Any one of these doctors can prescribe it to you. The duration for adults is around 7 days. For children, it might be a bit longer, around 10 days. And some simple over-the-counter medication that you can take are nasal decongestants, which can be oral or it can be in the form of a tablet. Some antihistaminics like levocetirizine or cetirizine. You can also use a nasal saline spray, which would really help a lot in cleaning your nose. So that can be done. The nasal wash can be done 2 or 3 times in a day. If your condition especially is not improving with these medication, or you might be evolving into a chronic sinusitis, the doctor would then take a call to prescribe intranasal steroid sprays. Of course, this cannot be taken over the counter. It has to be prescribed by a doctor, and this is usually prescribed for a certain longer duration based on your symptoms. So that it can go up to anywhere from 5 to 1 week or 5 days to 1 week to even longer than that. So intranasal steroids are another option, and something known as leukotriene antagonists like montelukast can also be prescribed to you for treatment of sinusitis. Now, in case of acute sinusitis, there are certain red flag signs that you should definitely watch out for. A fever that goes beyond 3 days or is not subsiding or responding to paracetamol, a steadily worsening headache. These are two very important red flag signs. And third, being the person suffering from the sinusitis, if they're looking worse, very toxic, very sick, you should immediately take them to a nearby hospital. And this is especially very important if there's a fungal sinusitis, because fungal sinusitis tends to make the patient a lot sicker and does require treatment more commonly in a hospital setup. Are there certain home remedies? So sinusitis home remedies can be very simple, like a steam inhalation or warm salt water gargling. They won't cure it, but they might make you feel symptomatically better. So you can do steam inhalation once a day. That's more than enough. Please don't overdo it. And in your diet, you can include things like ginger, amla, lemon, pepper, turmeric, or even saffron, which might, work towards just making you feel much better with your symptoms. Like I said, it won't help in a cure, but it makes you feel symptomatically much better. Apart from this, are there certain people who are prone to sinusitis? Yes. So people who have a deviated nasal septum or polyps in their sinuses are more prone to sinusitis. Are there any investigations that you need to do? Or that decision will be taken by your treating doctor, but most commonly in a chronic or a subacute sinusitis case, they might advise you to get an X-ray PNS, or otherwise known as X-ray paranasal sinuses, or a CT scan of your paranasal sinuses to understand if there's some structural deformity or change that is predisposing you to a chronic or recurrent sinusitis. It's very important that you address your sinusitis as soon as possible. Either you can take some over-the-counter drugs, or you can go to the doctor to try and understand if it's an infection, or is it just an inflammation or a reaction to certain allergies. If you're allergy prone, also you will get recurrent sinusitis as well. So very important to keep in mind. Try home remedies, try over-the-counter medication, but if you're not getting better, please get in touch with a doctor to help you further with treatment and management. Thank you very much. Namaste.
Don't forget to like and share this video. For more such videos, do subscribe to the MFine channel and hit the bell icon to never miss any update.